Welcome to SeriousTech, Engineering the Future, a podcast where we deep dive into the critical role of domain expertise in shaping successful careers in technology. In a rapidly evolving tech landscape, mastering a specific domain is what sets top engineers apart. Join us as we explore how domain tech is transforming industries with a special focus on healthcare, and hear from experts who have built cutting-edge solutions by combining technical brilliance with specialized knowledge. If you're looking to stay ahead in your tech career, this is the place to be. Joining us today is Akshaya Subramanian, a trailblazer in healthcare interoperability and integration, currently serving as the Associate Vice President at CitiusTech. With nearly 13 years at CitiusTech, Akshaya has been instrumental in pioneering advancements in healthcare systems integration. Her significant experience includes roles ranging from a technical lead to senior solution architect. Akshaya's expertise in connecting diverse healthcare technologies and leading complex projects has been crucial in enhancing patient care and operational efficiencies in the healthcare industry. Today, we'll dive into Akshaya's unique insights on the future of healthcare interoperability and explore how innovative approaches are setting new benchmarks in the field. Akshaya, it's a pleasure to have you on the podcast. Welcome.
Thank you, Laurel. Likewise, it's a pleasure meeting you as well.
You've had quite a remarkable career journey spanning over a decade with CitiusTech, as well as just various roles in the healthcare technology sector. Could you please tell us a little bit more about what that journey has looked like for you?
It was definitely an interesting journey. So I started off my career with SeriousTech as an integration tech lead. I slowly got the opportunity to build my expertise around different healthcare standards, AI tools, and it sort of paved a way for me to get into the practice, the interoperability practice, that is. This is where I was introduced, to the world of looking at business use cases. I did play the role of an interop SME or consultant on multiple projects. And right now, I'm on a stint of playing the role of a delivery lead. I am managing the cross-functional teams with diverse technologies, and yes, trying to solve business problems with technical solutions. I do want to make a point here, another point that across these years, what has kept me going is the fact that SeriousTech always thrives on building health tech experts. It always fosters the culture of learning, keeping an open mind for any suggestions that anyone has. And I believe that maintaining this symbiotic relationship with the employees is what has kept me going here.
Quite a unique journey. And so thank you for sharing that with us. And as that's continued to grow in such a dynamic field of healthcare technology, as that field itself is growing. And can you share maybe a little bit more about how a career in interoperability and integration engineering within healthcare not only differentiates itself as its own specialized domain, but also enables its engineers to make a real and tangible difference in improving patient care and really impacting human lives?
I'll probably answer this, with personal journey of mine, with the projects that I've worked on and how, the projects have evolved. So imagine we have this use case of physicians wanting access to patient data. Now, a decade back, it was about working with 5D limited formats in the form of HSR and B2, working with some of these interface engines, building interfaces for different health systems or disparate systems to interact with each other. Then we moved on. I've done projects on health information exchanges, which is typically onboarding a network of providers and helping them facilitate data sharing for, again, the same use case where they want access to patient data, but now it's across providers. And to the whole fire boom, which happened, last decade, where it was about making patient data available easily to providers as well as to the patients, which are the consumers. to now, even looking at the more recent, Gen AI related solutions or AI related solutions where the focus is still, access to patient data, but it is making it more comprehensive, making it more in the form of a narrative or a summary, so that, it's easier for a physician to be able to, make decisions for the patients and to give the right care to them.
Yeah, I mean, when there is a lack of maybe optimal interoperability and integration, that directly impacts what the speed, of how a physician can give care, which impacts directly the patient outcomes and the patient care. And so those are really great use cases to bring up. And I would like to dig a little bit deeper into those. Can you provide maybe some examples of specific projects or some innovations, if you can, that have led to measurable improvements in that healthcare delivery?
Okay. So I have had the opportunity to work on multiple innovative engineering solutions, including projects that are related to pure play engineering, where we want to move legacy applications to more modern architecture, more a microservices based architecture. Or there has been multiple projects which have moved from on-prem and there's a cloud migration aspect involved in it. Or we've built mobile applications or a scalability platform for sure performance engineering. Now, all these works that happen in the background, ultimately the objective is to ensure that the time for a patient care or the patient wait time is reduced, or maybe physician is able to focus on care for the patient, or maybe there's a better coordinated care. So this is always the objective. While in background, we are working on these multiple technological solutions and solving complex technical problems.
Absolutely. I mean, within healthcare tech, I would understand that everybody's role is so important and critical, obviously, across the board. But I can really see, as an engineer, as you're creating systems, as you're creating different projects, as well as just even improving the interoperability and the speed of how things are working, all these things directly impact outcomes and the patient lives and can save lives, if it's not too bold to say it. And that's really exciting work. It's really exciting, to be a part of that, of course. And something that you mentioned earlier when you were talking about your career journey was this collaboration and a sharing of ideas at CitiusTech. And it's something I want to explore a little bit further with you. What is something that makes CitiusTech such an exciting place for IT professionals to work?
So I have always been part of integration projects, but when I joined CTS Tech, I think the impact that it has is much more meaningful. We're always solving business use cases and business problems, but the sheer diversity of projects, right from the problems we try to solve to the nature of work, the technology that we are using, the mode of execution. There are multiple opportunities, that are available within our CTS Tech. And what I really like is the focus on the fact that while we are working in a particular market, on a particular project, an individual's role is always the practice, where he or she can achieve the depth that they want to in terms of the core expertise that they want to continue working on. They could be with the latest tech in their area, be up to date with the latest happenings in the industry. At the same time, when they are part of the project, they receive the breadth in terms of understanding the different business use cases, and even having to work with technologies which complement their own core expertise. So this, I feel, is something personally, I resonate with, that I am able to achieve the depth along with the breadth that I feel any IT professional would like to.
That's an excellent answer. Depth and breadth. That's it allows for growth and an exciting diversity in projects, and it sounds like a very exciting place to be for IT professionals and being in that domain. And Akshaya, it's been such a pleasure to have you on and get your expertise and have this discussion with you about interoperability and integration. Thank you so much.
Thank you so much. I'm happy that I got this opportunity to share my experience with you.
Thank you. The SeriousTech Engineering the Future podcast is brought to you by CitiusTech, a leader in healthcare consulting and IT services. To find out more about CitiusTech, visit citiustech.com. To listen to more interesting insights on healthcare technology and innovations, search and subscribe to CitiusTech's YouTube channel.